I'm Dr. Lindsay Berlind. I am from Ann Arbor. I have always wanted to be a veterinarian. Apparently I told my family when I was 2 or 3 that I wanted to be an animal doctor, and they didn't believe me. I used to wake up on Saturday mornings really early and watch Jack Hanna on Saturday mornings. I thought he was a veterinarian, turns out he wasn't. But I wanted to be like Jack Hanna. He always got to experience so many different animals, just a wide variety of animals. He clearly cared about each animal individually and making sure that they had the best housing and they were cared for appropriately. The conservation of them, and I really loved that.
My name's Ashley. I'm the practice manager. So basically I deal with any of the problems that we have, scheduling, hiring, payroll, things like that. I like all the emergencies that just walk in. I worked at a day practice before. That was walk-in as well. So I can't really see myself working in like a day practice where it's scheduled. I like just constantly moving on the go. We don't know what's coming in.
I'm Gail Marco, and I'm a customer service representative at the front desk. I love my job. I love people that love their animals, so it's kind of two-way for me. It's both the people and their pets, so pretty dog passionate for the most part. I like cats, but I love dogs. Yeah, I met her, and it was right when the clinic was starting, and I just love what EVH stands for. I also love that we are the only local place, that we're not a corporation. Our prices are reasonable. She still wants people to be able to afford ER service, so that's always been a big thing for me. I think I'm just always proud of working for a place that still is supporting local business. I think it's important. I like to do that for anybody, but especially when it's for ER medicine. It's really rare these days. Most ERs are corporate, and she isn't yet, so hopefully she stays that way.
My name is Caitlin. I am the overnight office manager, and I also am a licensed veterinary technician. Overnight, I do kind of a dual role. So I manage behind the scenes, make sure the workflow is smoothly, while also taking care of the patients that need more critical care. There are several patients that need care either on a 24-hour basis or that an emergency happens in the middle of the night and there's nowhere else for them to go. So being here and being 24 hours is a really big thing for our community. So growing up, my dad always was the one to rescue animals. He'd be the guy who found a squirrel on the side of the road and brought it home. He would nurse back baby birds to health and wait for them to leave the nest, so to speak. So I got a lot of my love for animals from him, and we always had animals in and out of the house growing up. So naturally, I got that bond with animals as well.
At Emergency Veterinary Hospital, we are open 24 hours a day, 365 days a year. Since 2012, we have been providing affordable, high-quality care for basically any household pet. So that includes dogs, cats, exotics such as small mammals, reptiles, birds. But beyond emergency care, we actually provide much more than that. So for the patient who's had surgery at their primary vet's office and may need some additional monitoring in that post-op phase, we can do that. For the patient who's been diagnosed with a serious illness, such as diabetes, pancreatitis, kidney failure, liver failure, heart failure, or other respiratory diseases, and they may need some intensive care and monitoring 24 hours a day, we can do that. For patients who are diagnosed with a blockage in their intestinal tract or their urinary system, or maybe they have some other significant injury such as a diaphragmatic hernia and they need surgical intervention, we can do that.